Hi, welcome to my channel. I'm Dr. Sridhar Kalyanasundaram, consultant neonatologist. Thank you so much for subscribing and sharing the videos, and I hope they are helpful. I had a request from one of my patients who had twins to produce a video on multiple pregnancy. I was thinking what to say, so I have split this video into two parts. One will be on just an overview of what multiple pregnancy is, especially focusing on twins. What are the complications we may face with them? And the second video is going to be more interesting in terms of parents with babies admitted to the hospital or the NICU. So it's a little bit of a follow-on one with what we had with Mrs. Kushbu Sanjania, and this is with Dr. Sania Mariam, who is our pediatric dentist. She herself had twin babies, and that will be coming out very soon as well. So I hope these videos will be useful for you. So in terms of multiple pregnancies and twins, the incidence has been increasing over the past 30 years or so. This is because of two factors. One is the women are choosing to become pregnant when they are older. There is a higher risk of multiple ovulations when they're older, and also the chances of infertility treatments being needed when you're older makes it more likely to have multiple pregnancies. So the natural spinning rate is about 1 in 250, and most of these are identical twins. However, because of the non-identical twins and because of fertility support treatments happening as well, the twin rate that we actually see is about 1 in 80. The triplets happens 1 in 8,000 pregnancies or so, which is not very common. So triplets is having 3 babies in one pregnancy. More than triplets like quadruplets, pentuplets, etc. is very rare. Throughout my career, I've seen 4 quadruplets. Of course, triplets we see more often than that, and you can say the incidence of more than triplets is more than 1 in 400,000 or so. So this illustrates how twinning happens. And when you talk of identical twins, you have one embryo that is monozygotic. So we have an egg and a sperm joining together to form the embryo. One embryo splits into two fetuses, and they have a shared placenta. The degree to which it is shared will be discussed next. When we talk of dizygotic twins, actually it's two separate pregnancies which happen together. So the conceptions of the two eggs and the sperm joining together, two separate embryos, and they have two separate placentas. So the gender may be different in dizygotic twins, but it's always the same in monozygotic twins for obvious reasons. The genetic mix is also almost identical in terms of monozygotic twins. They're not always 100% matching, but most of the carrier types are matching in them. So when a single embryo is created by the union of a sperm and egg, it divides into two embryos. Each embryo is monozygotic, it's genetically identical, and both will be the same gender. So depending on when the division occurs, the identical twins may have separate placentas as well as gestational sacs, or they may share a single placenta but have separate sacs. And in rare cases, the identical twins may be in the same amniotic sac. This is monoamniotic monochorionic, which is not very common, and this illustrates further. So if the separation happens at different stages, so we have two sacs full, it can happen with both identical twins and non-identical twins. When there is a single sac separated by just the amniotic membrane being in separate sacs, so the monochorionic diamniotic we call it, and this is a more common type of identical twins. When we have a single sac, both the babies are sharing the placenta, sharing the chorion, which is the outer lining, and the amnion, which is the inner lining as well. So this is not very common, and the chances of twin-to-twin transfusion and other problems are more with the monoamniotic twins. When we talk of identical twins, one very important problem we face is something called twin-to-twin transfusion syndrome. So this occurs when blood flows from one fetus to the other through a blood vessel connection in their shared placenta. So poor growth occurs in the donor twin who is depleted of blood flow and so the nourishment. Excessive fluid develops in the recipient twin, so who is receiving this excess blood flow, they may go into heart failure, and we get a condition called hydrops where there is extra fluid in the fetal cavities. In order to save the twins, we may have to do early interventions like therapeutic amniocentesis, where we remove the liquor from the fetal sac. Laser coagulation of the blood vessels which are causing this transfusion can be done, and that is a life-saving procedure in these cases. Of course, you need great expertise, and only the experts in fetal medicine can do this, so it's not available in many centers. Non-identical twinning, as we discussed, happens when separate eggs are each fertilized by a separate sperm, and the embryos are dizygotic, they're not identical, and they can be of the same or different gender. Most of the time, this is the type of twinning that happens from assisted reproduction techniques, because when you take a medicine like clomiphene, for example, more eggs are released in the same cycle, and if both the eggs are fertilized, it results in twin pregnancies. The size of the babies can be different in both monozygotic and identical and non-identical twins. In identical twins, one of the reasons is twin-to-twin transfusion, but it can also be because of the size of the placenta and the ability to supply being different. The main risk when we face preterm delivery and birth, so when we have multiple pregnancies, there is less space, you are more likely to go into preterm labor. 60% of the multiple pregnancies are born prematurely compared to about 10% of singleton pregnancies. Because the space is less, the presenting part is not often the head. The head being delivered coming down is the easiest way to deliver and the safest. So if a baby is coming leg first, for example, we may choose to do a cesarean delivery to be safe. So more of cesarean sections in twins and multiple pregnancies. The length of gestation depends on the number of babies. So the outcome is obviously related to the prematurity, the degree of growth restriction, and whether any associated complications are there, like the twin-to-twin transfusion. Because when you have twin-to-twin transfusion, you have a higher risk of reduced blood flow to the brain, and that can be harming the fetus as well. So this illustrates that when we have a singleton pregnancy or a single fetus, mostly it goes up to term and the weight is 3.3 kilos. When you have twin pregnancies, many of them deliver at 35 weeks and weight is around 2.3 kilos. Triplet pregnancies, most of them deliver by 32 weeks. You would be lucky to go beyond that. And the weight is around 1.6 kilos. And quadruplet pregnancies, obviously, many of them deliver quite early. The ones I have seen mostly deliver by 30 to 31 weeks. And it's really hard work to the neonatal team because they are premature, which means they need intervention and they all come at the same time. So really need a well-organized team, and we often plan and put the rota in advance because you don't know when they are going to deliver. So in terms of the risk of growth restriction, the placenta and the uterus are ideally made for one baby. So when you have more than one baby, the supply may be reduced, and so the baby may not grow properly. The placenta may also mature prematurely, and this may slow the fetal growth, especially late in the third trimester. In many instances, the obstetrician may deliver to electively do a cesarean at that stage, not to compromise the fetus further. So twins and higher order multiples that are more than 30% underweight on the ultrasound measurements are at increased risk of complications as well as the risk of mortality. The differential growth of the twins is not uncommon, and again, you may need to deliver early just to save one of the twins who is not growing very well. This may be a little negative for the twin who is growing well, but obviously the decision is made keeping both twins in mind as well as the safety of the mother as well. One of the important aspects that we need to stress is that multiple pregnancy causes a great stress to the woman and their families. And obviously, if the babies come out premature, which is more likely, they may need prolonged hospitalization, and arrangements may be made at work, home, and family care as well. Even excluding the medical problems, the effect of multiple births on family life is substantial. It clearly affects the parents, other siblings, and the extended family. Financial stress and the heavy workload and lack of rest may increase the risk of postpartum depression. So I would suggest that the family should be very aware of this risk. The husband should support, the mothers and mother-in-law should support, and they should plan ahead of time if they need to bring more hands before the delivery, because the lack of rest can be very stressful. You need to sleep when you can. We'll be discussing more of this when we have the tips being discussed. And obviously, do subscribe and share. I would like you to spread this with families and friends who have multiple pregnancies themselves. So I would encourage you to comment on that as well. So I hope this is useful, and do subscribe and share. Thank you.